Hey guys, today we are going to study about maxillary sinusitis. So maxillary sinusitis also can be called as rhinosinusitis. Difference between both these terms is that sinusitis essentially means that it is involving only the sinus membrane, whereas your rhinosinusitis means it involves both your nasal as well as your sinus membrane. Now, what are the causes of sinusitis? So, sinusitis can be caused because of two factors. It can either be viral. Viral is in case when the duration is less than a week. When the duration is less than a week, it is self-limiting. That means it gets corrected on its own. No treatment is required. However, when it is bacterial, it is more severe as it is lasting for more than a week. On the basis of the duration, it can be further divided into acute 1 to 4 week, subacute 4 to 12 weeks, and chronic when it lasts for more than 12 weeks. It is not self-limiting, and the treatment required is antibiotics. Now, what are the clinical signs and symptoms of sinusitis? So, we can divide it into two types. One is your major factors and one is your minor. So, clinical features include major criteria and minor criteria. Here it will be, there will be facial pain and pressure. There will be facial fullness and congestion. There will be nasal discharge, nasal blockage, post nasal drip, hyposmia or anosmia, which means loss of smell. There will be fever, and one important is persistent discharge. Persistent, or we can say a better phrase for it will be purulent discharge from nose and fever. So these are your major criteria, which will be helpful when we discuss the how do we make a diagnosis. Then we talk about the minor criteria, which are related to your dental presentations. So that will be dental pain. It could Most common areas are maxillary molars and premolars. TOP will be positive, but there will be no periapical pathology. The teeth will be vital. Along with this, there will be headache, body ache, earache. So these are also things which we find in case of impacted tooth. There is pressure, there is dental pain, there is headache, there is earache. So we find these things in that also. We also find halitosis because of the pericoronitis, but this is also happening in the maxillary sinusitis case. So how do we differentiate it? Points other than this which help in differentiating it from a dental pain are, there will be nasal twang, there will be tenderness of maxilla on palpation, and there will be increased pain. Pain of face increases when patient asks to bend face forward. So this helps us in differentiating it with the dental pain. Now we come on to the reasons why do people have this sinusitis? So first it could be because of the excessive secretions in case of allergic cases. There is a disease which is called as the sick cilia syndrome, in which the action of cilia, ciliary action of nasal passage, is reduced. It is not that the cilia are doing their action of cleaning the nasal passage. So this could be a reason. Another reason could be abnormal quantity of secretions, like abnormal quantity of secretions. That means there are thick secretions. Abnormal quality of secretion. We have done with the abnormal quantity of secretions in allergic cases. Abnormal quality of secretions is when there is thick secretion. And this occurs in case of cystic fibrosis. Then there can be blockage of the osteomeatal complex. This is a complex which is formed by sinuses, turbinates, meatuses, and the nasal mucosa. What is something that can cause a blockage in this? And the example can be a nasal polyp. Nasal polyp can cause a blockage of this osteomeatal complex. Other than that, the reason could be GERD. There is a higher incidence of maxillary or rhinosinusitis being reported in cases of GERD patients. So how do we make the diagnosis? The diagnosis is made on the basis of that uh, the case history and clinical features. So first is if there is a purulent discharge from nose, or the second which we can say it's a maxillary sinusitis is we are seeing two major criterias, or we are seeing one major and two minor criteria. Any of these possibility will lead to this thing. Now some other diagnostic test which we can do is first is your transillumination. So in this test what we do is we take a transilluminating light source and we try to see maxillary sinus through it, and this we are putting it intraorally. So we try to see it. Normally what should happen in a normal case that the sinuses should be clear, sinus is clear. But in case when there is sinusitis and we do the same procedure, we won't see this thing. Clear sinus is not seen. Abnormality is sinus not seen clearly, which is due to thick secretions, thick or purulent secretions. Then the other additional diagnostic tests are the X-rays. The X-rays which we can do is PNS, Waters view, and the occipitomental. So after this, all the diagnosis, we move to the treatment. And the treatment for the sinusitis is, first we'll do the conservative treatment, that is the medicinal treatment. So we'll give the medicines first, which we give in case of bacterial causes, antibiotics. We can give penicillin, we can give cephalosporin. Other medicines which we give are nasal decongestants. It could be local, topical, or systemic. Systemic example would be D total, and then we can also give Vicks Action 500. Their contents is phenylephrine, caffeine, and paracetamol. We can also give Sinarest. Sinarest is also having phenylephrine, which is a nasal decongestant. In local or the topical one, we can give oxymetazoline or xylometazoline, which is a nasal decongestant, or we can give the Otrivin nasal spray, which is also another type is Naziviron. So, what is the mechanism of action behind this nasal decongestant? Let's see that. The mechanism of action behind it is, it decreases the nasal secretion. It decreases the nasal secretion and it shrinks the nasal mucosa. It decreases the nasal secretions, it shrinks the nasal mucosa, and hence it increases the nasal patency. By alpha receptor mediated vasoconstriction of nasal and sinus mucosa. This is the basic main mechanism of action. Now we can give antibiotics, we can give nasal decongestants. Other than this, we can also give antihistaminics, we can give steroids. However, when we talk about the topical and systemic are not preferred because we all know it will have systemic side effects. So we prefer topical. In topical, we can give flucortisone, and after this steroids, the other treatment is very important, mast cell stabilizers. What will they do? They try to decrease the histamine release. An example for it is sodium chromoglycate. Then we can give leukotriene antagonist or inhibitors. It includes montelukast, which comes by the brand name Monter LC. Montelukast plus levocetirizine. It's actually a combination of montelukast and levocetirizine. Then we have mucolytics. The mechanism of action for it is, it decreases the viscosity. So it decreases the viscosity of secretions. That means it makes the secretions thinning of secretions. And the example would be guafencin 600 mg BD or QID. Then we can also give nasal saline washes of the crushed secretions. Then another natural beneficial thing would be nasal inhalations, steam inhalations. So it improves the aeration. Now, once we have discussed this, what is the indication of surgical correction? Why is that we might need a surgical treatment? So we require it when there is a failure of the medical treatment. To remove the chronically inflamed hyperplastic membrane. Foreign object or a oral antral communication being formed. It is due to that. So these are the indication, and now what are the surgical procedures? The surgical procedures which we can do are, first is the Calvé-Lou procedure, and the second one is the Denker's procedure. Let's study about them. First is the Calvé-Lou procedure. Other name for this procedure are canine fossa technique, canine fossa approach, or we can say it as sublabial approach. And the indication are same, that it is to remove a chronically inflamed maxillary sinus, to remove any pathology, to remove any pathology, to remove any anterolith. What is an anterolith? That means a stone which is found in the maxillary sinus. Then to control the bleeding within the sinus. And it is also done to support the floor of the orbital floor, to support the orbital floor fracture from antral side. Another procedure which is done in continuation with the Calvé-Lou is intranasal antrostomy. Intranasal antrostomy is done. The indication is basically to retrieve the gauze piece which is packed into the antrum during the Calvé-Lou. Or we can say to improve the drainage, we do this procedure. And question which is most commonly asked, it is done through which meatus? So done through inferior meatus. Then we have Denker's procedure. Just basic information which we need to know about this Denker's procedure is, it was first described by the person named Denker. However, it was popularized by the Starman and Confield. Then there are two approaches to proceed with this type of procedure. That is your Denker's extranasal approach and Denker's piliform approach. Two approaches. That's all about the maxillary sinusitis. Thank you.